just given birth and your body has gone through lots of changes. Now it's time to take good care of yourself so that you can recover. I'm Dr. Jaquiba Henderson, and I'm going to review some important information that you and the people supporting your recovery need to know before you go home. Most of the time, moms recover after birth with no complications. However, you should be aware of a few serious and sometimes life-threatening complications. Part of taking good care of yourself is knowing warning signs to look out for. In this video, you'll learn about signs and symptoms of high blood pressure, which is also referred to as preeclampsia or hypertension by your healthcare provider, postpartum hemorrhage, and postpartum depression and anxiety. If you experience headaches that won't go away, or blurred vision, or you're thinking of harming yourself or others, call 911 or go to the emergency room immediately. If your bleeding increases or you're saturating 2 pads in 2 hours, call your provider for immediate help or go to the emergency room. Remembering the signs and symptoms in this video could save your life. High blood pressure puts extra stress on your heart and kidneys and can lead to heart disease, kidney disease, or stroke. Preeclampsia is a kind of high blood pressure that can happen during pregnancy or up to 6 weeks after giving birth. It can be very dangerous and can lead to serious health problems if not treated. Seek medical attention right away by calling your doctor or 911 or going to an emergency room if you experience the warning symptoms of postpartum preeclampsia. These symptoms include a headache that doesn't go away, changes in vision like blurriness, flashing lights, seeing spots, or being sensitive to light, swelling in your face or hands, gaining weight rapidly, severe nausea or vomiting, pain in your belly, most likely on the right side, under your ribs, trouble breathing or difficulty peeing. Sometimes postpartum preeclampsia happens without you noticing any symptoms, so your postpartum checkups are very important. Sometimes, after delivery, you may experience more bleeding than normal. This is called postpartum hemorrhage and is a serious condition that can happen up to 12 weeks after having a baby. You're more likely to have postpartum hemorrhage if you've had it in the past, had a cesarean birth, or if you have certain medical conditions that affect your uterus, your placenta, or how your blood clots. After delivery, it's normal to have some bleeding. For the first few days, your bleeding will be red and heavy and will begin to slowly decrease each day. Then it will become watery and change from pinkish brown to yellowish white. After about 4 to 6 weeks, your bleeding should stop. Seek medical attention right away by calling your doctor or 911 or going to an emergency room if you experience heavy bleeding that doesn't slow or stop, such as filling 2 or more pads in 2 hours, passing ping pong ball-sized blood clots, severe nausea or vomiting, pale skin, swelling and pain around the vagina or rectum, symptoms of shock, including feeling faint, confused, dizzy or weak, having chills, clammy skin, a really fast heartbeat, or trouble breathing. Let's talk about your well-being and emotional needs after giving birth. The weeks at home following birth can be physically and emotionally exhausting. You've been through a lot, and sometimes with the emotions and changes of giving birth, you may be caught off guard by the sadness and mixed feelings you experience. And some births don't go as hoped or planned. Depression and anxiety are common feelings after giving birth. They can occur soon after birth or months later, and it's not your fault. These medical conditions can get better with treatment. There are many different signs and symptoms of postpartum depression and anxiety, but a few include strong feelings of sadness, worry, and tiredness, feeling shame or guilt, having disturbing thoughts, having little interest in things you normally like to do, feeling unable to take care of yourself or your baby, having trouble bonding with your baby. Share the feelings you're experiencing with your support system. partner, family, friends, and/or your provider. Seek medical attention right away by calling your doctor or 911 or going to an emergency room if you have intense symptoms of postpartum depression for several days, or you're thinking about hurting yourself, your baby, or anyone else. There is help and support for you. Never feel that you're in this alone. After giving birth, you need to allow yourself time to recover, both physically and emotionally. Your family, friends, and providers care about you and want you to have a healthy recovery. Don't ever hesitate to reach out for help. You know your body best. If something doesn't feel right, let your provider know. If you have any of the warning signs mentioned in this video, seek medical attention right away by calling your provider or 911 or going to an emergency room. Be sure to let them know you recently gave birth. One last important reminder: schedule your postpartum checkups before you leave the hospital. We want to make sure that you're recovering as expected, so go to all of your postpartum checkups, even if you feel fine. We wish you a safe recovery. Please consult with your healthcare provider for any questions or concerns.